Thank you very much for coming. Thanks to everybody for being here for the work session. Before we get started, and we'll do this again when we get to our board meeting, I do want to point out that Metalworks, Mark Maddox from Maddox Metalworks, came today and donated the three-dimensional sign of our logo behind us. Has real Georgia marble hanging. I could reach back and tap it, but I'm afraid it'd fall off the wall and screw it up. So, but it's individually cut out pieces of metal that were then pieced back together, where he did a pretty phenomenal job with it. So it was installed just a few hours ago. They brought it in, so I want to make sure to bring that up. So if you see Mark somewhere, if you would, tell him thank you, especially everybody county employee-wise that he came in and donated and put it up, and it looks pretty phenomenal. So got to say thank you for that. We'll dive in with department updates first. I'm going to ask for volunteers for who wants to go first, and then there are a couple of you I may call on and point you out. But if anybody does have anything in particular, I know Paula's got a couple things we're going to go into later, so we'll hold off on her. And I knew Philip would be the first to raise his hand.
I'm going to get nowhere.
Yeah.
Because you always going to look. That's why I got that
I was
icon.
trying to roam back and forth.
No, just a quick update on the water plant at Grandview. We've had to do some extensions on some paperwork, and we've got a new, I'm going to call it a project schedule. The plans and specs was submitted to the EPD in December of 2020. Well, they was approved, I think, 2 months ago. So now we're going to hopefully have bid openings December of 21, and then the notice to proceeds in April of 2022. And then completion of construction in April of 23. That's a lot more than we've got in the past 6 or 8 months for that project, so hopefully we can stick to this and stay on schedule. The Highway 136 project we've been working on, we got about 2,800 foot left. It's been a rough month already. We've had several leaks. The guys have worked probably 18 to 20 hours a day for the last 10 days. So I've got to give kudos to them. We've had 9 leaks in 9 days, and one day there was 3 leaks. So you can tell they was tired. But we've been working on our leaks and setting our meters. So that's about all I have. I just wanted to give you an update on the water plant.
So I'll point out one thing, that we've recently passed the new policy that allows overtime during the holiday pay period. And we had a holiday pay period, and we've had 8 different water leaks that they've had to come out in the middle of the night to work on. So I believe that they're testing this new policy as fast as they can to stay up. But they have been working like crazy. I know Philip was trying to take care of them last week to get them lunch and get them taken care of, and then sure enough, right afterwards, they had another pipe that they had to come out and fix. So if people, and in a public forum, I know Philip and I've had this conversation, on the west end, whenever there's a line, one of the main areas that ruptures, when that line starts to leak, because the way that it's currently configured, if they have to shut that line off to fix that line, it does shut off a large portion of the west end of Pickens County. That's one of the things that we've talked about with the American Rescue Plan funds, that we're moving forward next year to create that loop that provides constant flow, where if you have to shut it off, you shut it off for one spot, you don't shut off for the whole side of the county. So if you're getting complaints, I don't know if you guys get them like I do, but
I got a well too.
yeah. I got a phone, and I've heard about it a few times. So it's just the way that it was put in, it's the way that it was installed, and we're working toward the fix next year. I do believe we'll have that completely fixed. We're working at the speed of engineering, so that's not necessarily fast, but that is in the works. So if you do hear about it, it's just because there's only one line going into the Jerusalem Hill City area. So they've done a great job getting it back online. I know they were working with the school system on one of the leaks, trying to get the school open in the morning to get enough pressure to flush the toilets at Hill City Elementary School. So
by 8:30 they had enough pressure, and they called to think we don't have to close school.
Yeah.
I didn't want to be the one reason why they had to close school. The power company's okay, but not me. I don't want to be the cause because.
But you don't want a school running with a bunch of elementary kids with no toilets, so that wouldn't be a good thing. So, but thanks. Anybody have any questions or anything, water? Any other volunteers before I start singling you out? Wes, we'll let you Yeah, then.
Everything's running smooth. We almost have a full complement of people, so it seems like the activity in the county is steady and moving on. I've had some odd proposals come before me as far as developmental. They haven't made fruition yet, but everything seems to be going well.
Good. Thank you. You feel like you've been thrown in the deep end of the pool yet, or?
Yeah, but I have a lot of help, and I appreciate that from Justin and from Bill, so, and you, and I appreciate that.
Good. We're glad to have you in there. So Kenny, I don't know if you were really trying to raise your hand, if that was.
Well, I was in the motion, but somebody, you know how.
If you got anything, I'll go ahead.
Yes, sir. I didn't get to make the meeting last month because I was kind of busy, but last month we actually hit our first goal. We've actually shipped out 1 million pounds of recycled goods. So that's a lot of weight there. Next out of the landfill. Keep Pickens Beautiful. Just got the banners in. We got them put up and installed. So now when customers come through, they have a better understanding. They have signs hanging that they can actually look at and tell what products go in what bays to help cut down a lot of the confusion, because you know recycling is confusing if you don't know what you're doing. So, and then we got the glass pulverizer in, and we've actually got it up and running, and it's going to look real good. Glass be crushed in sand. We'll be able to reuse it a lot of things. The roads, backfilling in. There's actually a market for to sell it. People want it for their arts and crafts, all kinds of different things.
Have you got a stockpile of it where it's building up?
Well, we've got a stockpile to the side yet. We just haven't got our concrete poured yet, so we can do the base.
Right.
But as soon as that gets there, it'll be ready to go.
Okay.
And then, you know, we've had with COVID going on, we've had a lot of people that keep coming in to recycle, and they'll pull up my people and say, "I've got COVID." So y'all just be praying for my guys, because we're exposed right to it. People just come every day and drop our stuff off. So I worry a lot about them guys. But you know, I got a good crew, and they're dedicated in there every day, and they take care of everything y'all need done for them.
Good. Thank you. No question?
I'll go ahead and get mine. I'll go ahead.
Could you have some masks there, and if they come out and say?
See, what's happening is they'll actually pull up and get out of the car and say, "Oh, you need to get back from me, I've got COVID." And it's kind of too late when I just like for the public to be aware, you know, if they come up, at least have the window cracked down or something and say, "Hey, here's your some money," or.
Yeah. That may be the way they're trying to get some free service.
Well, I would send them on through, go on.
Let them go on.
We don't want your money.
I'll be there Saturday.
No, you don't.
I mean,
Your picture's already up like the
it's
post
good to
office on the wall.
I think it's good to encourage regardless, but especially in that kind of setting, just because you're outside, if you do have it, there's no reason in exposing others that put them at risk at all. So.
Yeah, I'll go next.
Oh, I appreciate you volunteering.
Had the guys out chip sealing this week, and we covered up a lot of the pipes where we'd changed them back in the spring. On our chip sealed roads, they went back and covered them back over where we've had the gravel patches. We've now got that patch back with the chip sealing. Next week, we may have intermittent closures on Henderson Mountain and South Basin. We've got to change that pipe out going into the upper end of the lake there. I think we're going to be able to detour through the subdivision there if we do have to close it completely down, but just be aware of that work going on. We got the bore done under Refuge Road there at Parker Road. Stancil helped us with that, and got a drain under the road now, and a nice structure there, and all of that's working to help about the water sheeting across the road there, and it's already made a big difference. It's working really well. And other than just mowing and cleaning out ditches and taking care of our maintenance before weather sets in, that's all I've got.
You get a little bit of a dry season. With the state, I probably shouldn't have encouraged you by even making that statement just now. Any other departments wanting to go? I know Justin's been actively working on digging and researching on grants. He was presenting some the other day, so getting ready to move forward with that. Angela, with the courts, is a grant maniac too, so the two of them, I think, are working to help keep us trucking along. All right, so I'm gonna move over to Paula. I'm gonna come back to Sloan in just a few minutes when we get to COVID. If you've got any other updates, I'll get you to do those at the same time. But Paula's, with Human Resources, has got some updates from our health insurance renewal from dealing with them, so I'm gonna turn it over to you now.
Okay. We're looking at 2022, and in 2020 and 2021, we've been with Cigna, and they have presented with a renewal and with no change in the administrative fees, but approximately a 16% increase in the reinsurance. And our broker, MSI Benefits, is still negotiating with that. He has also got some other offers for reinsurance and administrators, which would come in at a lower cost. And then he just called me today, and he's talked with Anthem, and they have got back with him and agreed to give us a proposal. And he hopes to get that back by next Wednesday, and he feels really good about that. And they've agreed, if we have to, we've looked at some other pharmacy benefit providers, and Cigna will not allow us to use their network and go with a different pharmacy. But Anthem has agreed that if we have to do that, that they would do that. And so, with the different options, there's a lot of different pharmacy benefit managers out there, but he is looking at one that could be a substantial savings if we decided to go that route.
And if he does get us those numbers by next Wednesday, then we'll be able to, in October, because we've got 2 weeks before our next work session and board meeting, so we would be able to have those numbers hopefully ready before we go into our next work session to get him to present, and where we make that decision. So we should still be on pace for October for getting it, that way open enrollment can take place after that.
And Matt asked me to let y'all know that he would love to have came, but he had a prior engagement already, but he hopes to get to meet with staff somehow before.
Thank you.
So Sloan, on the COVID side of things, I know you've been tracking numbers. Give us an update.
Well, today's been kind of a busy day away from the office, so, but I did get some numbers pulled together, but it's not quite the update I normally like to give. But I am kind of glad to give this one. Looks like for the time being, the only reason I hate to say this, I don't want people to let the guard down and spike back up, but last several days have been a heck of a lot better than last week as far as the numbers each day, or daily numbers. We're back down to single-digit numbers each day, so that is a positive. Last week it was, anywhere from 20 to 30 a day, it felt like. So, well, it actually was, but, and actually the state numbers has gone down a little bit. The one thing that is kind of seems to be a little bit on the increase, which our deaths in the state over the last week seem to be a little higher than they've been in the past. So that's not really a good sign. But Mako did start doing testing at Mount Zion. They're doing it every Tuesday from 8 to 3 at Mount Zion, which is at 1036 North Main Street. We also have the flu drive-by shots on the 28th of this month at Mount Zion as well. So we'll have testing going on. That's also a Tuesday, so we'll have testing going on and the flu shots going on at one time. They do have 2 different overhangs, so the testing will kind of move to the front overhang, because I think that'll be, it's just so hard to get them signed in, get your insurance and all that for your flu shot. So they need the longer wraparound, which is where Mako is using every Tuesday right now. So Mako will move to the front and we'll put the flu shots just like we've always done them in the past. We were able to get from the stockpile quite a bit of masks and gowns that our EMA had put in for. We've got those. We put in for a bunch of gloves as well. We do not have the gloves in yet. So, and there's actually some more gowns that are supposed to come. So that's pretty positive for the stockpile as well. So we did get some free stuff.
Sloan, will you have the booster shots out at Mount Zion?
Right now, they have not approved those. So, what has been approved is for, immune deficiency people, they can get it now, but that's it, autoimmune problems. So, they have not got that approved. The last I heard, they were still looking at hopefully having it approved through the week of the 20th. So, which is next week. Yeah. So next week, they were supposed to bring that back up. And then it'll still be an 8-month period from your second dose is what they're looking at doing. So, I can actually speak for myself. So I'd be looking at like October before I could get it. So. Any other questions that you've been thinking of?
On that same note of your question, are they looking at it for each, for Moderna and for Pfizer for the boosters, or is it just one?
Yes, they're looking at both. The one thing about it is, those are basically based off the same type of drug, the mRNA. So they're saying you can actually mix them, if you wanted to. At that point, you can actually mix your vaccine. Is what they're looking at, you know. Now, what they end up approving, I don't know. CDC is saying that we don't need a third dose. Government's saying we do. So right now, we're kind of in a spar off, I guess you could say. So I don't know how that's gonna work, to be honest with you. I can tell you I'll be first in line though, but it's okay. I'm good.
I've seen too many people that's had the vaccine and got it and not have the symptoms as versus my son-in-law that had it and it was on the urge of hospital. So, you know, if you ain't got the vaccine, I'm not saying go get it, but go get it. I mean, it's just, God, I mean.
We sat in on a call the other day and we're listening to some different things, and they were discussing that 95% of the cases are unvaccinated cases right now, and then I think it's 97 or 98, I don't remember the exact number, with the deaths were unvaccinated versus vaccinated. So I mean, there's significant proof that they're showing that it is helping with the seriousness of sickness, but there are some people that have issues that can't, and I'm still of the stance that it should be your choice. I'd love to do exactly like he said, that I encourage you strongly to go take care of yourself and get it unless you have a health issue preventing it. But I'm a believer in you should have the right to choose. That shouldn't be our job as a government to tell you have to do something. So that may be popular or unpopular, but I'll stand behind that as you should be the ones that can pick that, to choose that.
Absolutely.
So on general discussion, anybody have you guys have any topics? No, you know? Anybody else have anything? Roy, I went right by you when I was asking for volunteers. I apologize.
Probably the biggest update on our end is tax bills are coming out. And evidently in the modern age of technology, people have signed up for text alerts for their tax bills. Now that would come from the tax commissioner's office, not our office. We're getting a lot of calls. And what we're seeing is people that sold property a couple of years ago, but they're still getting the text and they're thinking, oh my God, how am I getting this other bill? So just be aware that that's out there, and if you get it, contact the tax commissioner's office and say, please remove that from my property.
Well, that is all we have. I know it's a little bit before 5, and we've got our 5:30 regular meeting. We had a little bit less on the agenda for today for the work session. We got, I think, a little bit more to come onto it for next month. So it'll be a fluid increase when we go through there. So it's 4:51, and we adjourn from the work session. Thank you.